Hello, I'm Dr. Mark Schrumpf from the CPMC Total Joint Replacement Center, and I'd like to introduce you to our video guide to shoulder replacement surgery. In this video, we'll help you prepare for surgery by reviewing what to expect before surgery, while in the hospital, and once you've returned home. In this video, we will discuss what is a shoulder replacement, what to do before you are admitted to the hospital, what to expect in the preoperative area, how we manage your pain and other symptoms after surgery, what to expect during your hospital stay, the role of our physical therapy and occupational therapists in your recovery, what to expect once you're at home, and how your family can help you recover, and finally, where to get answers to your questions. During a shoulder replacement surgery, new surfaces are applied to the humeral head, or ball, and the glenoid, or socket. We place these implants through a 4 to 5 inch incision on the front of the shoulder in order to perform the procedure. One of the tendons of the rotator cuff is opened. At the conclusion of the case, the tendon is repaired. The majority of the recovery is based on the healing of that tendon back to bone. At the end of the procedure, the skin and soft tissues will be closed with sutures and a special skin glue. When you wake up in the recovery room, your incision will be covered with gauze and a clear, waterproof dressing. Before your surgery, you'll need to visit with your primary care doctor to make sure you are healthy enough to undergo shoulder replacement surgery. When you visit with your doctor, it's important to discuss the medicines you are currently taking and if any of them should be stopped or changed before shoulder replacement surgery. In the days right before your surgery, you can do a few things to reduce the risk of getting an infection at your surgical site. First, we ask that you shave the area around your shoulder 7 days before surgery. This removes the hair at the site, but leaves enough time for your skin to heal should you nick yourself shaving. We also ask that you shower for the 3 days prior to your surgery with a special antimicrobial soap called chlorhexidine. HibaCleanse is a common brand available at most pharmacies, though any soap with chlorhexidine is fine. Please refer to the pre-op packet for more information on how to prepare your skin before surgery. On the morning of surgery, you will report to the ambulatory care unit. Here, a nurse will help you into a surgical gown and start your IV. We often start preoperative antibiotics at this point. In the ambulatory care unit, you will likely meet your surgical team, including the anesthesiologist, your surgeon, and the operating room nurse. We will review with you the surgical plan and ask you to sign a consent for surgery. It's natural to be concerned about how we will manage your pain. We take your pain very seriously too. We use several cutting-edge techniques to control pain in concert called multimodal pain management. Before surgery, we'll give you medications to prevent pain before it even starts. The anesthesiologist will discuss with you the option of placing a nerve block that will help control your pain after surgery. Finally, we use an advanced combination of intravenous and oral pain medications to ensure that you are feeling well enough to start your therapy quickly. We also keep on top of other symptoms like nausea so you feel strong enough to focus on your recovery. After surgery, our orthopedic nurses, who handle hundreds of shoulder replacements a year, will care for you 24 hours a day. Not only are they your doctor's eyes and ears, they will help you feel well enough to get back on your feet and ready to work with our therapists. CPMC has one of the best rehabilitation departments in San Francisco. Our therapists will work closely with you to teach you how to get in and out of bed correctly and position yourself with pillows for good support, how to don and doff your sling correctly, how to dress and shower with your operated shoulder, which exercises to be done after surgery and which to avoid. Occupational therapists will work with you every day to teach you how to manage your sling in the next few weeks. Physical therapists, if needed, will assess you for your ability to mobilize safely after surgery. The occupational therapist will review with you specific exercises we want you to do in the days following your surgery. The most common exercises are pendulums, where passive motions used to allow the shoulder joint to move, hand range of motion, wrist range of motion, forearm range of motion, as well as elbow range of motion. All of these exercises will help keep the rest of your arm limber. Finally, the therapist will show you how to get in and out of your sling safely. We at CPMC take your health seriously. We want to make sure everything goes smoothly with you and your new shoulder. Getting you up and out of bed is a critical part of keeping you safe. Walking helps prevent blood clots as well as pneumonia. Our nurses and therapists will work closely with you to make sure that you're feeling strong enough and are stable enough to mobilize. We are vigilant against blood clots. We provide compression devices that keep the blood clots from forming in your legs. Plan on needing help around the house for the next 4 to 6 weeks with chores, groceries, and transportation. It may be a good idea to stock up on groceries and place commonly used items within reach. We also provide helpful checklists and suggestions in our preoperative guide that you will receive before your surgery. Preparing for surgery may feel daunting, but the entire team at CPMC looks forward to helping you through the process from beginning to end. Learn more about our orthopedic program by visiting us at cpmc.org. I'm Dr. Mark Schrumpf. I would like to thank you for watching this video, and I hope it's been helpful in preparing you for your shoulder replacement surgery.